My name is Jill, and my primary role is house supervision, but my extra shifts are spent in the COVID isolation unit.
My name is Rachel Mallion, and I am a registered nurse at Door County Medical Center. I primarily work in the ICU department, since I work in the ICU department, I also work in our COVID department because that's primarily staffed by ICU nurses.
My experience with the COVID-19 patients is that it's been a shocking experience. Being in a pandemic just in general has been definitely a lifetime, I don't want to say opportunity because that seems like a good thing, and it isn't. Just in the last 8 months, it's just crazy how in the beginning there was so much uncertainty and it just continues to grow. So these patients are scared. They're scared because they have COVID-19, and that's just really scary. And then you put them into this isolation room, which is what it is. They're isolated from the outside world and their families. So their emotions are just really overwhelming, and we do our best to make it a comfortable experience or a more welcoming experience to help with their fears.
We don't just have to do our role as nurses, we have to cover other roles too. We're drawing everybody's labs, we're PT, we're OT, we're case management sometimes, and helping people try to troubleshoot discharge plans, and what else do we do? Dietary and IT, and we literally do all of it. It takes a lot of time and effort just to walk into a room, not just physically, but sometimes emotionally and mentally. It's a lot to even just walk in the room, and it takes a lot of time to lump all your cares, do everything that you need to do, and then go to the next patient. So I think the nurses at Door County Medical Center do a really good job of treating the whole person, no matter what, but it does make it harder. We laugh with them, we grieve with them, we get angry with them, we pray with them, we celebrate with them. So outside of medical care, we try to do little things to bring comfort to patients, whether it be running to McDonald's and getting iced coffee or parfait. That was a patient favorite for a while, or going to Culver's for a shake or stuff like that. My favorite thing that we've done is we wrote a journal for one of our patients that were there very early on. To help her and to help her family, because she was very sick and didn't really remember one day to the next, and it also helped us. It helped us to. There's just something therapeutic about writing things down on paper, and now it's something that her family will have forever.
So many family members, they're just in disbelief. They can't believe that they have a family member who has COVID-19. They, either they don't know how they got it, or, oh my gosh, do they have it now? And sometimes it's the family that gave it to them, and they're the ones suffering. The patient in the bed is the one suffering. They're the ones going through this because of a potentially careless act of not masking, large gathering, not maintaining any type of social distancing. And unfortunately, some of them are losing their lives, and it's the last time they're going to see mom or grandma or grandpa. And it's just really unfair. I want the community to know that now is the time to put everybody else before yourself. Swallow your pride, wear a mask, socially distance, stay away from unnecessary gatherings. I want this to be over just as much as everybody else. So if we can just buckle down, do this could be done sooner rather than later.
We've done everything on our end to keep you guys safe that we can do. And now we need your help. We need the help from the community to keep each other safe and protected from COVID-19 and to stop the spread of this disease. And that means doing the things that we're told to do, masking and keeping safe distance and not going out in public if you're sick. And I think that one of the things that isn't necessarily stated outright that you would think that everybody would know is if you know that you're positive, stay at home. Like, you need to stay at home. If you're supposed to be under quarantine, be under quarantine, because you're setting us up to fail when you don't do those things. You're infecting other people, and then people are like, I have no idea how I got COVID-19. And well, it's probably because somebody was walking around without their mask on and they knew that they were positive.